All right, welcome everyone. Today we're going to go over different types of masks, their uses, and how they can best protect you in this era of COVID-19 and any other infectious disease. So, from left to right on the table here, we have three different levels of mask. On the left, we have an improvised mask. You might see these in the community. People have made them from cloth, old t-shirts, etc. Middle of the table, we see a procedure mask or surgical mask. Now this is a medical grade mask that's used extensively in the hospital and surgical setting and does provide a good barrier to prevent droplet and aerosolization in the hospital environment. The final one is the N95 rated mask. So N95 refers to the size of particle that this mask, when properly fit tested and applied, can filter. So it'll filter 95% of particles 0.3 microns or greater. So this is the mask that we'll be using for our own responders in search and rescue. It is important to note that the N95 masks does need to be fit tested, yet if you haven't been fit tested, it does give a much better protection than, for example, a surgical mask, and a significantly greater protection than an improvised mask in the community. So one big thing to note with N95 rated masks is that they're electrostatically charged. So if there are any viral particulates that land on the filter portion of the mask that's protecting your respiratory tract, it will adhere and be kept on the mask itself. So a really important thing to recall when you are wearing one of these masks is not to touch the filter portion of the mask. Anything you touch with, even if you're wearing gloved hands, if you do touch the filter area of the mask, you will be transferring that to everything else you touch. So really important that once you have one of these masks properly applied, you do not want to touch the filter. Even when taking it off, you're taking it off from the sides. So, big important things to note when you're dealing with different masks. These type of improvised masks are more for protection of others around you. So for example, if you're going your day-to-day, going to the grocery store, pharmacy, where you aren't able to physically distance as much, this is a good way to stop the spread of your own droplets as opposed to protecting yourself. So we wouldn't be using these so much in a SAR context, a SAR response. This would be more for putting on a subject to reverse isolate. And when I say reverse isolate, what that means is we're putting it on the subject or leaving it for the subject to put on so that they don't spread those droplets out and potentially contaminate us. So this is all in the context of COVID-19, which are large droplets that can cause that contagion. Now, of course, we will, as SAR members and volunteers, we will be wearing an N95 mask if we are, within that 2 meter, 6 foot distance from the subject to protect ourselves on top of that. So the improvised mask helps reduce the spread, but we're still well protected with N95. So it just stops more particulate from coming onto the mask. So when we're talking about properly putting on these masks, it's important to note that you need to do proper hand hygiene, really fastidious hand hygiene. So if you have access to soap and water, if you're at the SAR hall, for example, or in an environment where there is access to running water and soap, you can use that. Otherwise, our primary use will be alcohol-based hand rub, for example, something like this. You might see it in a bottle this size, as long as it's WHO, that's World Health Organization standard of at least 70% alcohol, it'll work just fine. So, in order to properly perform alcohol-based hand rub or hand sanitizer in the field, you're going to want to put hand sanitizer about the size of a dollar coin into your palm of your hand. So in putting that amount, you start with both palms together, making sure you get all surfaces of your hands. You go towards interlacing hands on the top of both hands, inner sides, making sure to get both thumbs, wrists, and finishing off with your fingertips on both sides. If you still have remnants of the alcohol-based hand rub on your hands, you can continue to move it around. Once your hands are dry, then you're safe to put on any procedure mask or N95 mask, taking them out of the packaging and appropriately putting them on. So we'll go over the highest level of personal protective equipment that we have with search and rescue at this moment. So this would be used by SAR members that are responding, and only those who would be in direct contact with the subject. So within that 2 meter, 6 foot spacing, you'd be wearing this full level of personal protective equipment. And this is to ensure the utmost safety of our responding members. So this would include our team Gore-Tex outerwear jacket, waterproof Gore-Tex pants, which creates a barrier for droplet airborne particulate contaminants. It would also include safety goggles, glasses, an N95 mask, medical gloves, as well as a reverse isolation procedure mask to put on the subject themselves. So, like everything, we'll go through how to properly don, so put on all this personal protective equipment, and that always starts with proper hand hygiene. So in the field, we only have access to alcohol-based hand rub. You might see it in containers this size, smaller size, as long as it's the WHO level of hand sanitizer, that'll work just fine. So just like we've shown before, you want to put about a $1 coin-sized amount in the palm of your hand. And again, rubbing your palms back and forth, thumbs, wrists, and finishing off with the ends of your fingers there. So making sure that it dries, and if there's still any remnants of that alcohol-based hand rub, making sure it's dry, and then your hands are clean and you're able to go to the next step. So the next step, if you're not already wearing your outerwear Gore-Tex layer, you would want to put that on at this time. Being that it's becoming more warm during the day, if you're exerting yourself, you might not want to be wearing the full outerwear because you might get very warm. But this would be a good time to put on this outerwear. So putting on the Gore-Tex pants, putting on the Gore-Tex jacket, and then you can move on to the next step. So the next step would be actually applying the N95 mask. So the N95 mask, in terms of search and rescue, we will be giving every member that goes into the field a small personal protective equipment kit, which would include an N95 mask, one of the procedure masks to leave for the subject to put on, as well as safety goggles. Now, in terms of the N95 mask, you'll notice that you don't want to open the package until you need to actually apply it to your face. So by opening the package, right now it's clean. Your hands are clean because you've done the hand hygiene. So you can take the mask out. You can see that there's 2 elastic bands, the red elastic bands here. So with those red elastic bands, you want to put them out to the front of the mask, so the area that's facing outwards. And you can open the inside of the mask. So you can see top is where the gray area is. There's a metal band in the N95 as well that can help form fit to your nose. So you want to put it towards your face, making sure that it's above the bridge of your nose, underneath your chin, and while you're holding it in place, you'll be putting both elastic bands on your face. If you do wear personal prescription glasses, it's a good idea to take them off first or during this procedure. And making sure that it's above your nose and really tucked in. Once you have the mask applied, it feels comfortable. You want to make sure that you use 2 fingers, one on both sides of the nose, and smooth down that metal section in the mask itself. Once you have the mask secured on your face, you want to perform what we call a negative and positive pressure check. So what that means is While you're wearing the mask, you want to breathe out and in. And you should feel the mask contract and expand slightly when that's happening. And that means that you'd have a good seal. For some members that are not fit tested to the mask, you might not be able to get a proper seal, and you might not have that proper positive negative pressure check, and that's still fine. This does provide a much superior level of protection than, for example, a procedure mask would. So now that we've used our clean hands to put a clean mask on, the mask fits properly, the next step will be to put on our safety goggles. So safety goggles still with the clean hands. We can then put them over our prescription glasses if that's what you wear, or just on your face as a regular matter of course. And what this does is it adds an extra layer of protection against splash blood body fluids that may contact your face. Currently, we do not have a supply of face shields, so this would be something that you'd have a face shield covering your whole face. We are sourcing those, so when those come available, that will be a better item to use as opposed to just the goggles. So the final step in putting on the personal protective equipment is the medical gloves. Now, it's really important to note that with your team jacket, you want to have the cuffs as tight as they can go, but still have movement. So you can see that they're tight against your wrist, and you want to do that on both sides. So when you apply your glove, you bring it on, and you make sure that the cuff of the glove goes over the closed cuff of the jacket. This creates that continuity of droplet and airborne precaution from glove to jacket all the way down to pants as well. If you're wearing the team jacket, the Gore-Tex jacket, you want to have it zipped up as high as you can, just to reduce any contamination. So same thing on the other side. You have the other glove, applying it on, and making sure that it is over the cuff of the Gore-Tex jacket as well. While you're doing this, you can have another one of your teammates checking and making sure that the cuffs are proper, everything else, different pockets are closed, etc., making sure that you're putting it on properly. So that kind of concludes donning personal protective equipment in the search and rescue environment. Just note that you may also be wearing a helmet, and that will be very helpful when we get the face shields, because it will help if it's windy conditions from that face shield lifting up. So one helpful tip to bring into the field with you as a team is to bring the cheat sheet on how to properly don and doff personal protective equipment. So one of these should be brought into the field with each team. It's based on the BC Ambulance guidelines on how to properly don and doff. You'll note that instead of a Gore-Tex jacket and pants, they're using medical grade gowns, which works well in the pre-hospital ambulance environment, not so well in the search and rescue wilderness environment. It has step-by-steps with highlighted areas where it shows when you should perform hand hygiene with alcohol-based hand rub or soap and water if you have access to it, which we generally would not in the field. And the real important part is the doffing. So you note that every time that you perform hand hygiene, it's also highlighted. So when you're donning something, you do that initial hand hygiene and you're taking everything from clean packaging. When you're taking it off, everything is considered to be contaminated, and you want to be quite careful in making sure you're doing hand hygiene between taking every item of contaminated equipment off. So now we'll go over how to safely doff or remove your personal protective equipment. It should be noted that this should only happen once you've finished caring for the subject and they've been passed on to another agency for transport to hospital or otherwise. So it's very important that as you are dressed in this potentially contaminated personal protective equipment, that you do not interact with other SAR members or other SAR members that are not also wearing personal protective equipment. They should remain at least 2 meters, 6 feet away from you while you're doffing. with your personal protective equipment pack that you were given initially, it was in a Ziploc bag. So please retain that Ziploc bag so that you can dispose of or keep some of the personal protective equipment for either throwing out or for washing, re-washing. So have a garbage bag with your team as well as that small Ziploc bag. So we'll go over how to properly doff personal protective equipment. So first things you want to do is you want to remove your gloves and perform hand hygiene. One of the biggest things about doffing is you want to perform hand hygiene quite often after every layer of personal protective equipment that you are removing. So the next step would be removing your medical gloves. So most people have done this in first aid courses, but it's worth revisiting here. So taking your contaminated gloves, you want to either pull out or go under the cuff of the other one, pulling and exposing the clean side, pulling it over so that there's only the clean side exposed. Leaving some on your hand, you can use this to do the same thing on the other glove, pulling it, making sure that you don't contaminate, and you can pull both sides off, exposing only the clean side. This can be then disposed of in that PPE bag that you were given, and you can put that to the side. So now your hands are out of the gloves, but you will be touching something else that could be contaminated. So you want to perform hand hygiene. So we'll take some alcohol-based hand sanitizer. We'll do palm to palm, both sides on the top, thumbs, wrists, both sides, fingertips, and making sure that that's dry again. Now that we have our hands clean, now we can take the next level of personal protective equipment off, which would be our airborne droplet gown. In our case, Gore-Tex outer layer. So because your hands are now clean, you can safely remove your jacket. You can take the cuffs off. And if you can, you want to try and bring your arms in and holding the inside of the jacket. You want to use that contaminated outside to pull away and back and slip out of the jacket. So you'll note that I was holding the inside of the sleeve and sloughing it off my back, so I wasn't touching the contaminated areas. So this can be bundled inside out, and you can place it either with somebody else who has some personal protective equipment on and into a garbage bag, or you could put it to the side until you can actually place it in that. So you can see that the jacket here, I can place it on the ground because the inside is clean, making sure not to touch my pants, which are still contaminated. Opening up that garbage bag, holding the clean inside, placing it into the garbage bag, leaving it open. Because the jacket was covering the top part of the pants, I can safely unbuckle, bringing it out, exposing the clean. The zipper, because it's quite a ways down, you might be able to, you will be able to pull it up. The likelihood of your hiking boots, etc., being exposed is low. Again, on the other side, trying to do it nice and safely. Again, trying your best to use the inside material, which has not been contaminated, to safely get it off. So again, you have the interior. You can open that garbage bag. And now this garbage bag has all of your external personal protective equipment. You can keep that to the side for washing later on. So in terms of washing, follow the manufacturer's recommendation as hot as you can, given the recommendation, but the most important would be on a high drying cycle. So now that we've taken off that contaminated outerwear, we need to do hand hygiene one more time, or several more times actually. So again, alcohol-based hand rub, palms, face to face, or on top of the palm, or the hands, the thumbs, wrists, and finally fingertips. Again, making sure that it's all completely dry before you go to the next step. So next step is removing your goggles. So making sure you go back and you take it from as far back as you can and taking it away from your face. You can put these for disinfection to reuse, but it should be in a different bag than the one that your gloves were in. So you can put this into a separate bag if you have them, otherwise you can put them with that same bag. So I'll put them to the side for disinfection. And now that you've taken one more item off, now again we have to do hand hygiene. So again, alcohol-based hand rub, both sides, thumbs, wrists, fingers. And I know it seems tedious to keep doing this hand hygiene, but it's really important between each layer because each layer has possible contaminants on it. So it's important that you are diligent and you take the time to do it properly each time. So the final thing, and probably the most, I wouldn't say dangerous, but possibility of contamination would be removing the N95 mask. So if you are wearing prescription glasses, you can take those off and put them to the side. Now, real key important part about removing an N95 is as you're removing it, you want to close your eyes and you want to exhale as you remove it. So that way you're minimizing the risk of inhaling or having any particles go into your eyes or mouth or respiratory tract. Now, sort of the steps involved with that is you do not want to touch this face filter, because that's where the electrostatic charge I mentioned earlier is going to keep those viral particles on, so you do not want to touch that at all. So really what you're doing is you want to touch the sides of the mask. So you can take the elastic bands, you can bring them up, closing your eyes, and then you can close your eyes and exhale as you remove it away from your body. So that reduces any possible exposure you have with that mask. You can take that contaminated mask and you can put it in that Ziploc bag for disposal. At this point, we are not reusing any N95 masks. We're just disposing it after every patient or after every subject contact. So you can close that and that can be disposed in regular garbage. Now that you've completed that, if you do have prescription glasses, you should disinfect those first as well. And you want to do one final hand hygiene before you're now clean. You've completely doffed all of your personal protective equipment and you are safe to enter a vehicle and communicate and interact with other SAR members. So there's a quick tutorial on how to safely doff your personal protective equipment. Jason with Search and Rescue. How you doing?
Good. I'm
Good.
a little lost.
Yeah, okay. Are you injured at all?
No.
No. All right, if you just stay there, we'll ask you a couple questions, okay?
Sure.
All right. So we're just going to stay here just so we can do a little bit of a risk assessment if we need some personal protective equipment. Is that all right?
Sure.
All right, perfect. Have you had a fever, cough, flu-like symptoms?
No.
No, okay. Any difficulty breathing?
No.
Have you been traveling in the past 14 days?
No, sir.
No. Have you been exposed to anybody who's been traveling in the past 14 days?
No.
And have you had a diagnosis of COVID-19?
No, I have not.
No, okay. So what I'm going to do is I'm going to, and you're able to walk and move yourself around. You're not injured in terms of walking out. Is that right?
Yes.
Okay. So what I'm going to do is I'm going to leave a surgical mask here, and I'll step back. So just keep our 2-meter distancing. Okay. You're familiar with that?
Yes.
All right. So I'm going to leave this for you. Blue side goes out. There's a metal band on the top of it, and you can put that on. I'll move back the 2 meters. You can come and grab it, and if you want to put it on, and then
Put that on?
you can put that on, yes. And that's just for your safety, our safety, everyone's safety. Perfect, just like that. And you'll notice that there's that metal piece at the top. You can kind of mold it around your nose. Search and rescue! Hey there. Hey, I'm Jason with Search and Rescue. How you doing?
Not so good.
Yeah. Are you hurt at all? Injured?
Yeah, I fell down and hit my head.
Hit your head.
Yeah.
Are you able to walk, move around at all?
Not really, no.
No, okay. So just hang tight there. I'm just gonna put some personal protective equipment on, and I'll be right back, okay?
Okay.
You all good for a second?
Sure.
All right. All right, I'll be right back. All right, Mike, I'm just coming in. I'm gonna put this mask on you, all right?
Okay.
All right. You can give me a hand if you're able. Make sure that's comfortable on your face, and you can move that metal piece around your nose, okay? Good, okay. Now I'm gonna just do a little assessment on you, okay? We'll see if we need some more people to suit up as well, all right? So the rest of the team's just standing back, okay? So to recap, one of the most important things we want to consider while we're responding during this COVID-19 pandemic is the safety of our own members. We want to try our best and make sure that we always come first as responders. So if you're in doubt on whether you should be wearing personal protective equipment or not, please do wear it. We want everyone to be safe. Remember that it's you first, your team, bystanders, finally then the subject. So in terms of a SAR response, try and minimize the amount of responders that is within that area of contagion. So making sure to keep people at least 2 meters, 6 feet away from the subject, and only going and dressing up in PPE if you need to be directly involved in patient care. So I really want to emphasize that, that safety of our members come first, and we'll do it methodically, slowly, and make sure that if you need to put your PPE on, you remove yourself, put it on properly, and then go back in. It's very important to make sure that you're protected before you could expose yourself. COVID-19 does not discriminate. There's people that are asymptomatic or pre-symptomatic that can be carriers, and we want to make sure that we protect ourselves as well as the subjects from any possibility. So thank you for your time.